Hey, it's Dr. Brian McKay, a core health and Darien, and today I want to discuss tennis elbow, aka lateral epicondylitis. Medial epicondylitis would be golfer's elbow. Another topic for another day. So, what happens with tennis elbow? Let's go through the questions I get all the time. Will tennis elbow go away? Yes, if you stop playing tennis most of the time. Just ice it a little bit, and the pain will go away. Healing on its own is kind of tough if you continue to play tennis because you imagine twisting a rubber band that's already been twisted too many times, and that's typically what happens. So you're putting extra tension on the tendon, and the tendons are very sensitive, and you're gonna have a little bit of pain. It can heal. It definitely can heal, and it can always the tennis elbow come back if you don't change your swing. Probably is going to come back. Or maybe that's the time when you go out and get a lesson. I mean, if you go to the right place and get a lesson, you maybe will improve your swing, so it's not going to, so it's not going to be as terrible. So think about getting go out to the tennis pro and learning how to do a new swing or swing properly or changing your racket out. These are a couple suggestions. Another question I get is, are tennis elbow straps effective? Yes, they are effective. What they do is they remove the tension from the joint and kind of bring um, the pressure, the forces that get translated to the elbow joint, past it to the strap. So I think they're very effective. Another question we get is, are tennis elbow and golfer's elbow the same? One's lateral epicondylitis and one's medial epicondylitis. So similar, very similar, same vicinity, um, but not necessarily the same. Similar, I would say. Um, is tennis elbow and bursitis the same thing? They're kind of my estimate, technically no, but you're going to have bursitis because you have these fat pads underneath the tendons that inflame when they're overworked. So that's the one of the things there. So yeah, I think they kind of go hand in hand, but they're not technically the same thing. And another question I get all the time is, tennis elbow and carpal tunnel related? Yeah, they are. They can be related. They can be related, but not too often. To be honest with you, a lot of carpal tunnel comes from the neck. That's from, and yes, I'm a chiropractor, so I'm a little bit jaded when I say that. Um, Tennis elbow painful? Hell yeah, if someone's got it really bad. Next question is tennis elbow curable? I think so. We do a pretty good job here in my office. Use laser, Groston, joint mobilization. What else do we do? Laser, Groston, joint mobilization. We do the matrix machine on it. Um, assisted motion therapy on that. That's another thing too. It's pretty good for that. If it's really working, we immobilize the rest of the body. Just move that one joint, and it kind of reacclimates the brain to that body part which has been compromised. So it can be very effective. Here's another question: can tennis elbow cause shoulder pain? Yeah, definitely, because the shoulder, but it's the whole motor unit typically. So you got to think. You have to look at the cervical spine, lower cervical spine, upper thoracic spine, the scapula. If it's stuck, you're gonna put tension on the sits muscles. Um, those are the rotator cuff muscles. So you would stress on that area. So it's definitely can cause tennis elbow pain. Um, let's see. Let's go through my list of questions here. Can tennis elbow cause wrist pain? Yeah. If you bang that racket too hard, it definitely cause wrist pain. How does it occur? That's a good question. Um, the force when you hit the racket hits the ball gets translated, and your elbow is not in the strongest position. A lot of times it's bent, so when I think the elbow will be a lot stronger when the arm is locked out in full extension. So typically, I mean, some tennis movements that you are locked out in extension, but the ones where you're not, you put a repetitive sprain strain onto the tendons as they cross the elbow joint. And what happens over a period of time is the tendon just gets wound tighter and tighter and tighter, and it becomes very painful. And people ask me, what does tennis elbow feel like? Just ask anybody who plays tennis. It hurts. At the end of the game, they're icing it. It's popping tons of Advil and Aleve, and it's not really doing much for them. You feel a little bit better. Sometimes people go for a cortisone shot. That's actually a thing to touch upon. Cortisone. Listen, if you say you're playing in a tournament or you're going on a trip, you take advantage of stuff like that. Cortisone works some of the time. People think, and you really can't get too many because cortisone suppresses your immune system. That's something you're not aware of. It does suppress your immune system. So we definitely don't want you to have a compromised immune system. But in some cases, the pain is so bad that you're going to elect to do stuff like that. Um, what we try to do is we use laser. Laser kind of fires up the cells to regrow after we almost like internal debridement. What we do is we use a technique called Groston, and Groston's changed. The name is different nowadays. It's IASTM, Instrument Assisted Soft Tissue Manipulation. So using Groston or IASTM, we debride the scar tissue, and it's more like micro scar tissue. It's not like when you have you have a cut and they sew you up with sutures. This is more like the surface of the fascia becomes irritated, and the fascia is the covering on the actual on the muscle and the muscle tendon as well, and it gets irritated. And so what happens? It develops, we call adhesions, or little bumps in the road. Now, when you're receiving a Groston or IASTM treatment, you will pretty well likely have you're going to have those. You'll feel it when we're going over with the stainless steel instrument, that you'll feel these little bumps that are the adhesions. And so we're trying to remove the adhesions, and then the laser will come in and spark up the cells to regrow once we remove or debride the adhesions that exist in there. So if you think of adhesions as scar tissues, and then all of a sudden more scar tissues beget more scar tissue, and more adhesions, more. So it's a pretty chronic thing, and with the way people play, especially now with just hopefully coming out of COVID, where we've had people not being as active. Now all of a sudden they're going to go out and kill it on a tennis court. That's not too good. It's really not. So it's what are you going to do? Ice it and rest? And that does make sense to ice it and rest, but a lot of people won't. They just have to play the game, and I can understand that. I think it's pretty normal for people to want to do that. So you really, what tennis elbow looks like, it really doesn't look like much other than it's very sore to the touch, very, very sore to the touch. And the other thing to look for would be, so the other thing I say is, people, what's the elbow supporter brace the best? You just got to try it out. I particularly like one called Chopat, which actually is a variation, Chopat, CHO-PAT, and for tennis elbow. It's a company that came out one for knees, for chondromalacia patella. That's where the Chopat name comes from. But the Chopat is a company, CHO-PAT. I mean, I've seen them in Walgreens as well, so it's not like you can't find them in other places. So it's something to really think about. But that's what I like the best, and it's not too annoying, and you throw in the wash too, which is nice. Um, but I guess that's a personal preference. I mean, the other thing too is if you're playing, you always ask the tennis pro which ones they like, because they're going to see just as much tennis elbow as I do. Um, it's a question when tennis elbow won't heal. Well, it's time to do something different. It really is time to do something different. I had a patient who didn't he refused care, and that's his decision. But tennis elbow started, then his shoulders going, and I'm like, you can't sleep, you can't exercise. What are you going to do? He's actually just dealing with it. He's dealing with the pain. He's not exercising. And during COVID, he's probably put on 10 or 15 pounds. So it's kind of crazy not to treat it. But hey, listen, that's everybody's prerogative if they don't want to get. And when it does get worse, here's the one thing: your primary care doctor knows absolutely nothing about tennis elbow.